Good evening, everyone. Welcome to our 146th webinar on adult immunization. As Asrani sir is not near his laptop, I am going to do the honors of introducing Alka ma'am. As we all know, Alka ma'am needs no introduction. So Alka ma'am is going to facilitate this session today on adult immunization. Ma'am, over to you.
Thank you. And good afternoon, everybody. Should we start?
Yes, ma'am.
Now, what is immunity? We talk a lot about immunity, and the concepts are getting clear with the newer techniques. Basically, in simpler words, if I have to say, human body, whenever invaded by microbes I mean bacteria, viruses, parasites, and fungi. So whenever human body is invaded by microbes, the body will try to defend itself by counter-attack against microbes, by cellular immunity, which is by natural killer cells, and the humoral immunity, what we understand as immunoglobulins. Now, in this fight, if the microbes overpower our immunity, the infection or disease will occur. Otherwise, there will not be infection or it will be controlled. So immunity is of paramount importance if we want to defend our body against these microbes. It was as early as 19th century, Paul Ehrlich formulated the theory that there are substances, physiologically active substances, interacted with specific receptors in the blood, and therefore he introduced the concept of antigen. You see at the title, antibody generators are antigens. So these antigens, they come from the microbes and they generate the antibodies. So antibody generators are called as antigens. Then all of you know the story of Edward Jenner and how he developed the smallpox vaccine. That ushered in a new era of vaccinology. And then we knew that by giving vaccines, we can prevent large number of infectious diseases. As you can see here, I hope you are able to see. Now this is the microbe which is invaded here. And that microbe, the microbe is attacked by the macrophages because they identify this as something foreign to the body. Now these macrophages present these microbes to the helper T cells. Okay. And these helper T cells, these are lymphocytes only. But they are helper T cells because of their receptors. They are identified as helper T4 cells. These helper T4 cells, they expand, they proliferate and form the number increases. Now one of these helper T4 cells differentiate and forms into killer T8 cells. And these killer T8 cells then differentiate as natural killer cells. And these natural killer cells will attack the infected cells and remove them from the circulation. So these are natural killer cells or T8 cells. They are all lymphocytes, but they will attack the infected cells and destroy them. So this is natural killer cell. Then these helper T4 cells, they will differentiate into B cells. These B cells will identify the antigens and they will be responsible for producing antibodies. These antibodies will combine with these antigens and will attack the microbes. Finally, one of these cells will remain here, one of these cells will remain here, and two of these cells, CD4 cells, which have identified these microbes and they have attacked these microbes with the help of CD8 killer cells and with the help of B cells, that means cellular immunity and immunoglobulins, they will remain as memory cells. Okay. So whenever the body again faces the same infection, the memory cells will come into the play. So the whole, this process one doesn't have to undergo, and these memory T4 cells will immediately produce the antibodies, will produce the natural killer cells, and they will attack the microbes. So this is how the immune system functions. What are the vaccine preventable diseases? After smallpox, as I said, the vaccinology developed, and then we had so many vaccines as on today, and these are called as vaccine preventable adult diseases. I have not included smallpox because it has been eradicated long back. We have vaccine against chickenpox, diphtheria, influenza, hepatitis A, hepatitis B. We have not yet developed vaccine against hepatitis C, but hepatitis A and B, human papilloma virus, H. influenzae, measles, meningococcal diseases, mumps, pneumococcal diseases, rubella, zoster, herpes zoster, tetanus, typhoid, and whooping cough. Now, so many vaccines are available. We are advocating them. The medical fraternity is advocating, the government is advocating, and what is the result? This is the word scenario I am showing. Haemophilus influenza, more than 90% reduction in the cases, because these are vaccine preventable diseases. So if you give vaccine, there is a more than 90% reduction. In pertussis, global incidence reduced by 93% from 1980 to 2019. So in about 40 years time period, 93% reduction. Meningitis in UK, 99% reduction in cases among those aged less than 20. And more than 399,000 childhood deaths are estimated to be prevented annually from the pneumococcal diseases by the vaccine. So we have our pediatric vaccination program in place, which we have all been learning right from our student days. Over the years, every time these guidelines are modified depending on the new discoveries, new availability of the vaccine, and everybody is advocating this immunization program in the pediatrics. Indian Academy of Pediatrics takes the initiative and they formulate the guidelines, which are circulated to all the doctors. But what is the success rate? In spite of so much advocacy, so much of program, governmental support, only about 90% of the children have received the vaccines. You see the first dose of measles in 95%, 3 doses of oral polio in 90%, DPT 3 doses in 91%, BCG is 95%. That means still 50% is lacking behind. And 95% is also only because we give BCG vaccine on the 3rd day of the delivery before the lady is discharged from the hospital. So if the delivery is in the hospital, then only the child gets the BCG vaccine. If the delivery is at home, then most of the people, they are not aware about this and they may not take BCG vaccine. What is the immunization in the adults? Rabies vaccine, as and when the person gets a dog bite. So there is 20%. Tetanus is about 90%. Influenza, just 1%. Typhoid, 3%, because we feel now as we are adults, we will not develop typhoid. Pneumonia, 7%. Hepatitis B, only 8%. In spite of all the advances and diagnostic availability, only 8% of people are vaccinated against hepatitis B. As you can see this age chart, what is happening? This is, at the lower end is census of 2011. Okay. Oh. In 2011, we had 31% children below the age of 15. Okay. Now, with our family planning program, education, hum do, hamara ek and all. So the pediatric population is slowly becoming less and less. 2011, 31%, 2016, 28%, 21, 25%. By 26, it will be 24%. And by 2036, there will be 20% children below the age of 15. Of course, we have improved our infant mortality rate, longevity has increased, but because of our population control programs, the children below the age of 15, the number will go on decreasing over the years. The gray part next to that is adolescent, age between 15 to 19 years. And that is also going on from 10% to 7%. But if you see on the other side, the population between 20 to 49 years is remaining more or less the same from 43% to 46%. But on the right hand side, if you see here, you will see the number, the older age, adult age, that is more than 50 years of age, that population is increasing. So as this population is increasing, we will be facing some special problems of the people or senior citizens who are more than 50 years of age. What is the overall prevalence of vaccine prevented diseases in India? You see here influenza between 2015 and 2019. There were 126,000 H1N1 cases, okay, and 7,865 deaths due to H1N1 in 4 years. Pneumococcal diseases, 374 adult invasive pneumococcal diseases. Hepatitis A and hepatitis B. More than 37 million HBV carriers we have in our country. And these are all are vaccine preventable diseases, and still we are not aware about them, or we are apathetic towards our immunization. And therefore, the purpose of this lecture. So why adult immunization? I'm not saying that the patients who are above 50 years of age or senior citizens, they need to be immunized. I'm talking about adult immunization. So as per the definition, we are now including up to the age of 18, up to the age of 15 as pediatric, 15 to 18 as adolescent. And above the age of 18, we call them as adults. They also need to be protected against these diseases. Why? Because of the changing epidemiology of the diseases. Changing epidemiology of the diseases. Many diseases, many bacteria, many viruses, they are changing their colors. They are mutating. There are variants. Their attack rates are different. Their symptomatology is different. So the disease epidemiology is changing. There are many emerging and re-emerging diseases. Emerging means the infectious diseases which we were not aware of till now are coming. There are new diseases which are being reported. As you know, in 1986, actually it started in India, but 81, you all remember that we had made Alma Ata Declaration, Health for All by 2000 AD. That means the Northern Hemisphere had almost controlled all the infectious diseases, but Southern Hemisphere, that means developing countries, had major problem of these communicable or infectious diseases. So in Alma Ata Declaration, it was decided that all the out efforts will be made to control the infectious diseases in the Southern Hemisphere. This declaration was made in December 1980, and in next few months, there was a new disease which was reported from California, Northern Hemisphere. And within a very short time, this disease became pandemic, gripping all the nations of the world. As you all know, this was HIV, infectious disease. You all must be remembering, or you may recall the scenario in 1990. We had the first AIDS patient in 1986. By 1990, NACO had started very actively working. First was the community awareness and then all other things for the patient and all. I will not go into the detail. But those were the days when the doctors were scared to even touch the HIV infected patient. The same thing happened in last 2.5 years, Corona. Everyone was scared because there was no medicine. The disease was serious. The patient needed isolation, hospitalization, and quite a large number of patients needed ICU treatment. The transmission also was very scary. We have all gone through that nightmare. So these are the emerging diseases. And what are the re-emerging diseases? The diseases which we knew and we were claiming that we have controlled them. They are resurfacing. Last year in Kalburgi, more than 800 cases of diphtheria have been reported, and large number of them were the medical students from one medical college. So these are re-emerging diseases. So we have to be constantly on our toes if we want to fight these infectious diseases. So immunization of the adults above the age of 18 because of changing disease epidemiology, because of emerging and re-emerging diseases. And what is important is now we are understanding waning immunity of childhood vaccines. The immunity which is given to us by childhood vaccine, it starts waning over the years. Okay, and therefore there is need to revaccinate these people. Why adult immunization? Now I am talking about people, little middle-aged group or more than 50. Because of our better conditions, the longevity has increased. Earlier, the longevity was 58 years. But now, in India, the longevity of the females is 70.3 years, and in males, it is 66.9 years. So we have now aged population more than 6 decades, more than 60 years of age. So there is an increased longevity. With this increasing longevity, you may not have any disease, but still there is an age-related immune senescence. As we are aging, our immune system is also aging. So we have to be aware about this age-related immune senescence. So just because we were vaccinated earlier doesn't mean that we have the same memory cells and we'll have the same response, antibody response to the new infection. So age-related immune senescence. Chronic illnesses increase the susceptibility to infection. As with the advancing age, our population is having a lot of chronic illnesses which have been now called as non-communicable diseases. Infectious diseases are communicable, while non-communicable diseases or lifestyle disorders like diabetes, hypertension, coronary artery disease, they increase the susceptibility to infections. Same thing is true about COPD, asthma, and other respiratory problems. And lastly, if you have seen over last few years, we have many diseases. Just to give you an example, the connective tissue disorders, where we are using steroids for a long term. So steroids is also an immune suppressant. Therefore, we are using it in many autoimmune disorders. And therefore, when the immunity, diabetes, hypertension, CAD, COPD, they're all called as immune compromised diseases. Long-term steroid use also, because of immune suppression, will be a condition of immune compromise. So keeping all this in mind, we have to immunize the adults and the aging population against the vaccine preventable diseases. Unfortunately, what is the Indian scenario? We don't have Indian data of infectious diseases. We don't have an excellent surveillance system. We have surveillance, but we don't have a very good surveillance system which can communicate to every doctor what is happening in the country. Just 3 or 4 days back, I read it in the newspaper that there was one case of Zika was reported from Mumbai. So we get this news from the newspaper, not from the scientific journals or channels like our surveillance system. In spite of all these infectious diseases, we have yet to develop national guidelines for these vaccine preventable diseases. IMA has developed some guidelines. API has developed some guidelines, but they are not yet honored as national guidelines for adult vaccination or adult immunization. And therefore, we depend on CDC and other guidelines which are available in the medical literature. What is the impact of comorbidities in advancing age? If you see here, pneumococcal pneumonia per 100,000 population. In healthy adults, it is 8.8. In presence of type 2 diabetes, it is 51.4. In presence of chronic lung disease, it is 62.9. And in heart disease, it is 93.7. The pneumococcal pneumonia. So comorbidities like diabetes, chronic lung disease, heart disease makes the person vulnerable or susceptible to pneumococcal pneumonia, and this is how it goes on rising. Second example I would like to give to you is influenza. Risk of hospitalization in diabetes, this part has gone, I think, is, I think, 3 to 4. Risk of hospital ICU admission is 4-fold. Risk of myocardial infarction is 6 times more, which is in the first week of hospitalization. So just the influenza causing a risk of hospitalization in diabetes, and the risk goes on escalating, hospitalization, then the second is ICU care, and the risk of MI in the first week. So these are all such serious and grave conditions. Therefore, we have to protect ourselves against them. When we had this H1N1 pandemic, now WHO has declared that the pandemic is over. The pandemic is over, but we are still getting cases of H1N1. And when it happens in diabetes, presence of diabetes, there is a 3-fold risk of hospitalization, 4-fold risk of intensive care, 2 times higher mortality. And with this, there is an increased adverse outcome. Otherwise, it looked like innocuous, the pandemic is over, but still the cases are occurring. And these cases in diabetics are more serious, and this is what happens. The risk of hospitalization, the risk of ICU admission, and the mortality compared to non-diabetic population. What are the advantages of immunization, therefore? That it protects against vaccine preventable diseases. It prevents the community spread. If you are vaccinated, you are protected, and the community spread is also prevented. Actually, the whole community should be vaccinated so that these infectious diseases can be controlled. If you are not vaccinated and you get this infection, as I told you, the morbidity and mortality is so high compared to the normal population that the whole economics is affected. The cost of hospitalization goes on escalating. The breadwinner of the family is, if he is admitted, the whole family is affected. Apart from expenses of the hospitalization, there are many other factors. And I am yet to touch on the psychological trauma or stress that the whole family undergoes. But the whole health economics goes topsy-turvy, and it affects, because of the expenditure on hospitalization and healthcare, the economics is affected. And therefore, we should immunize people, so that immunization advantages I'm talking about, it protects against vaccine preventable diseases, prevents the community spread, your economic remains in a good robust form, and vaccine reduces antimicrobial resistance. Vaccine we are giving for prevention of a disease. Suppose if we don't give and the patient develops pneumonia, naturally we'll have to use different types of antibiotics depending on the sensitivity, depending on the patient's condition, comorbid conditions, and what type of an infection he has got. As we go on using these antibiotics, and I need not go into the details, you all are aware how irrationally we are using antibiotics, and that is how the antimicrobial resistance is increasing. So if we immunize the people and prevent vaccine preventable infection, then naturally the antibiotic use also will be restricted and antimicrobial resistance will be reduced. So these are the advantages of immunization, and therefore we should seriously think about adult immunization. Now, as family physicians, you must be getting large number of the cases with these conditions. And therefore, what are these health conditions which need adult immunization? That is type 1 diabetes, type 2 diabetes. These are all immune compromising conditions. Heart diseases, strokes, liver disorders, particularly cirrhotics, end-stage renal disease, respiratory diseases, COPD, asthma, asplenia. Previously, we used to do splenectomy for certain hematological disorders. You can have non-functional spleen also. There is asplenia. Function is affected. So again, this person is prone to develop, catch a large number of infections. So asplenia and long-term steroid therapy. So these are the conditions we have to be very careful and vaccinate them against these diseases. And lastly, these are all immune compromising conditions. And lastly, immunodeficiency, that is HIV and AIDS. There is a separate protocol for these HIV infected people, but they also are vaccinated. I had done a study by giving them rabies vaccine. They had a good, of course, we had given it to the patients with CD4 more than 200. The antibody response was good. It is above the threshold, but still it was markedly less compared to the normal non-HIV population. So that is the effect of immune deficiency. Okay, so all these conditions, please remember that these are the patients you have to advocate about adult immunization. Vaccine preventable diseases in aged or immune compromised states. At least concentrate on these 5 diseases: pneumococcal diseases, influenza, hepatitis, herpes zoster, and tetanus. So the vaccines which are recommended for all healthy adults, this is the API which recommends, is DPT, MMR, human papilloma virus between the age group of 9 to 26 years, influenza, all patients, all people above the age of 50 years, pneumococcal vaccine above the age of 65 years, and zoster vaccine, which has been very recently marketed for more than 60 years of age. So these are the vaccines recommended for healthy adult population. And naturally, these are the vaccines recommended for all those immune compromised conditions. So we have to take the history, take a clinical history, take the history of comorbid conditions. Okay, take a detailed history. What is the comorbid condition? What drugs he is taking? What is his immune levels? All this can be studied. History of prior immunizations, because immunization guidelines for pediatrics are changing. Now we have included even hepatitis B vaccine for children. So if he has already been immunized against hepatitis B, there is no need to repeat it. But if he has not, then please do the investigations, find out whether he is HBsAg positive. If he is positive, then look for the other antigens, then it becomes a HBV disease. Otherwise, that person should be given HBV vaccine to prevent the hepatitis B. And also inquire if they have received the prior immunization against anything, whether they had any side effects. Whether the side effects were mild, were they serious? Very, very rarely, 1 in millions, there can be anaphylaxis. So at least we should be aware that when we are giving a vaccine, we should be prepared with, all our drug tray and other instruments to manage anaphylactic reaction. But that is very rare, 1 in million, as I said. But ask for this history. If he has a history of anaphylaxis, then you should refrain or find out some other ways how he can be protected. CDC recommends many things. CDC recommends vaccines in the different age group. So they have grouped them like this: 19 to 26 years, 27 to 49 years, 50 to 64 years, and the age group more than 65 years. We have to also take the history of life events. If there is any infection which is, in the house, say there was a case of corona infection in the family, then naturally other family members should be protected, or in the vicinity, or any other life event that patient suffered from coronary artery disease, or he had some other, he is been detected as diabetic. So these life events we have to take into consideration. What is the nature of his job? Does it require frequent travel? If he is traveling a lot, that means he is getting exposed to many different communities and the infections prevalent at different places. Whether it requires international travel. In the international travel, the countries where he is going, the infections which are prevalent in those countries. So we have to consider them and we have to immunize this patient. And what is his lifestyle? As you know, recently, our young population is indulging into many things, many drugs, and the sexual activity. The sexual activity is also of different types. So it may be non-protected sex with the opposite sex, or it may be same sex, same gender, or it may be, there are very many things, and there can be many different types of sexual activities in these people. Drug addictions. Marijuana is increasing in these people. So we have to take into consideration the lifestyle disorders, and we have, what is the lifestyle, not disorders, what is their lifestyle, what kind of a life that they are leading. Have they indulged into any of these activities? Because that makes them more vulnerable for these infectious diseases. In addition to this, CDC recommends vaccination for healthcare workers. Some people call it as healthcare workers, others call them as healthcare providers. So all of them should be immunized so that they are in a good condition, healthy condition to take care of the patient's burden. At the same time, they are not transmitting the diseases. Therefore, we have to protect our health force, all the healthcare workers or healthcare providers with this vaccine preventable diseases, so they should be vaccinated. Pregnancy is a special issue that I'll deal in short time. CDC also recommends vaccinations for immigrants which are coming from different countries. And in India, there are many illegal immigrants coming from neighboring countries. We don't know what is their status of immunization. So all these immigrants should be immunized. Otherwise, they will go on spreading these infectious diseases. The same thing is true about refugees. And one more condition, international adoptions. Now, most of the people, the Westerners, they're adopting children from here. Naturally, they are immunized. If they are not, their countries will not accept them. They will first immunize them and then it will be accepted. So same thing, we have to also develop guidelines for international adoptions. So which vaccines can be given in the age group of 19 to 26 years? Hepatitis A vaccine, hepatitis B vaccine if he is not a carrier, then TDAP 1 dose, that is tetanus, diphtheria and pertussis, acellular pertussis. So there is 1 dose, and after that first dose, we have to give tetanus, diphtheria as a booster dose every 10 years. This is between 19 to 26 years. So hepatitis A, hepatitis B, and Tdap, tetanus, diphtheria, and acellular pertussis. In the same age group, we have to give human papilloma virus vaccine. Girls aged between 9 to 14 years, they are given 0 and 1 dose. And those who are more than 14 years, they have been given 3 doses, 0, 1 month and 2 months. And that should be HPV 2 or HPV 4. Similarly for males, because this human papilloma virus is notorious for causing cervical cancers in the women, but it can also cause cancers in the males and condylomas in the males. So males up to 26 of years should be given HPV vaccine 0, 1 month and 6 months, so 3 doses. People who are 27 to 49 years, all these vaccines have to be given. We hope that below the age of 26, they have received all these vaccines. If they have not, then at least HIV, hepatitis A, hepatitis B, Tdap, all this should be given. In addition, we should give influenza vaccine 1 dose annually. Okay, so 19 to 26 years, hepatitis A, hepatitis B, Tdap, and HPV. Above the age of 26, that is 27 to 49 years, all these vaccines plus influenza vaccine, 1 dose, that is to be given annually. And that the doctor only have to keep on reminding these people, because they are not enthusiasts and they will not remember that 1 year is over. So we have to maintain their diary, the records, and call them to take the vaccine, the annual dose of vaccine. Now let me just talk to you about herpes zoster. Previously, we used to believe that it is once you get chicken pox when you are young, the immunity is lifelong. But then we found that this virus remains latent in neuron ganglion and it gets reactivated. Varicella zoster virus gets reactivated when there is any compromise with the immune system. It is, you have seen herpes zoster. It is characterized by acute pain, and because of that pain and then post-herpetic complications, the quality of life is reduced. Common complications include post-herpetic neuralgia, which can affect up to 30% of patients, and it's a very, very painful condition. And herpes zoster is a very serious, herpes zoster ophthalmicus is a very serious condition. All those diseases that I talked about, diabetes, hypertension, coronary artery, and all these patients, because they have the immune compromise, are vulnerable to develop this herpes. And the most important, apart from all this, is simple aging. The aging exposes, because of the immune senescence, as I said, the aged people will develop herpes zoster. I'll tell you my example. One day, it was when I was 68 years old. I was returning from one wedding reception, and in the car, I started getting foreign body sensation in my right eye. I thought must be a foreign body in that, whole reception area. Something must have gone in the eye. And therefore, when I came home, I said, let me go home and then see what exactly is happening. Next day, my whole eye was swollen. It was closed. My upper lid was swollen, and there was total closure of my right eye. And I got really scared because I didn't know what was happening. I immediately rushed to an ophthalmologist. And the ophthalmologist said that, he told me inflammation of some glands there, and it will take 3 to 4 months. And every day I'll have to massage and take out the fluid slowly, and so many things. But there was no medication. I was really scared. He did all the tests. The vision was intact. That was only one point of comfort. But otherwise, my eye had totally closed. I came home, and then I was really worried. I was just taking rest. I didn't go to work. When I was just moving my hand through my hair, there was a very funny sensation on the hair on the right side. It was like sharp, sharp edge, like a knife. You have the sharp edge of the knife, that sharpness. That sharpness I was getting when I was moving my hand on my right side of the scalp, right hair. On the left side, they were normal. And I was wondering what is happening. I didn't know what to do. This was second day. Second day evening, slowly my eyes started opening up. Okay, so I had some hopes. The eye is opening up. First day, that foreign body sensation. Second day, closure of the eye, and this sensation in my hair. Third day, that sensation continued. And third day also, my eye opened, not fully, but there was good opening of the eye. Fourth day, I found one vesicle just above my right eyebrow. And then I said, oh my God, this looks like herpes. Luckily, that day, one of my dermatology friend had come home to see me, why I am not coming for the work. She knew about this whole thing. So she came to see me. And then I told her that this is how I'm feeling my hair. So she looked at the scalp. The vesicles had already dried up. So this was my trigeminal ophthalmic branch was involved, and I had vesicles only on the scalp. They had dried up. This was on the third day. But this is the day when I started acyclovir because the diagnosis was made so late. Very, very atypical presentation. Fourth day, I went and told the ophthalmologist. And then when I searched, yes, they have described closure of the eye because of this edema. After that, for a few days, I had this post-herpetic pain. And even today, my eye has become a little smaller, not the normal size compared to the left eye. Okay. Naturally, all investigations were done. Non-diabetic. First of all, I was worried about HIV. That was negative. No diabetes, no hypertension, no risk factor except age. And therefore, remember, all this aging population is vulnerable to this herpes zoster. Just 2 days back, I read that diabetics in Korea, the herpes zoster is in the epidemic form. And therefore, we have to protect all these people because now the vaccine is available. And this vaccine has been recently Okay, this is the review of herpes zoster in Indian outpatient department. 27 studies from 2011 to 2020. So in 9 years, we had 3,100 herpes zoster clinical cases. More than 50 years of age, 81%. Thoracic dermatome was seen in 38 to 71%. And you can imagine how painful it must be along with the intercostal nerve. Post-herpetic neuralgia in 10 to 54%. And secondary bacterial infection in 3.5 to 21%. Advanced age, first condition, HIV, diabetes mellitus, prolonged steroid use, malignancies, that is another immune compromising condition where frequently predisposing a comorbid condition. But don't forget advanced stage. Today, the herpes zoster infection in HIV has been markedly reduced because of antiretroviral therapy. These people are responding well. Their CD4 counts are really going high, and therefore they are not getting the zoster infection compared to our aging population and diabetic population. So please, now the vaccine is available. So please advise this vaccine. They have given you all the material. There is an antigen, there is an adjuvant, and that gives a good immune response. This is a recombinant virus. So vaccines which have to be given for people who are more than 50 years of age. DPT, which is today called as Tdap, tetanus, diphtheria, acellular pertussis. Varicella, that is herpes zoster. Influenza vaccine, more than 50 years of age. Pneumococcal vaccine, more than 65 years of age. And zoster vaccine, more than 60 years of age. Tdap, one dose, and then give TD booster every 10 years. Varicella zoster, two doses, 4 to 6 weeks interval. Influenza, give a quadrivalent vaccine. So tetraflu is quadrivalent vaccine, 0.5 ml intramuscular to be given annually. Pneumonia, Pneumovax 23, 0.5 ml intramuscular or subcutaneous, one dose, may be repeated after 5 years depending on the comorbid condition. And herpes zoster, that is Shingrix, non-live recombinant technique, 2 doses, 0 and 2 months. So these are the vaccines we should give for people who are more than 50 years of age. What are the special groups? I already said travelers, healthcare providers, pregnancy, immune compromise like all your steroid patients and these comorbid conditions, and immune deficiency. I'll just spend 2 minutes on pregnancy. Vaccinations. Vaccines consisting of toxoids. We all are familiar with tetanus toxoid. So toxoids, killed bacteria, killed viruses can be given during pregnancy. But vaccine consisting of attenuated viruses, because attenuated, still they are live viruses. They are attenuated in their infectivity, but they are still live viruses. So attenuated viruses such as mumps, measles, rubella are contraindicated during pregnancy. So also vaccine for yellow fever is contraindicated. You being a family physician or any doctor, if he comes across a newly married couple, you can spend 2 minutes talking to them about the planning of their family or pregnancy. And therefore, before conceiving, both the husband and wife should be healthy, should be free of infectious diseases. And this is called as a preconception counseling. So as a part of preconception counseling, we should do HBV diagnostics. We should see if they are carrier. If one spouse is a carrier, the other spouse should be protected by giving vaccine. If one spouse or if the mother, if the wife is HBsAg positive, then we should do other antigens like core antigen. We should look for her infectivity. Now there are drugs available, so we can treat her HBV disease. But if not, and if both are HBsAg negative, then we should give them HBV and hepatitis A vaccination. So hepatitis A vaccination, hepatitis B vaccination should be given before conception. Swine flu, that also should be given. COVID-19 can be given at any time during pregnancy. We have taken 2 doses of COVID-19. Now there is CDC is thinking about, because new variants are appearing, the cases are increasing in America and the European countries, and therefore now there will be a committee which is set up, and they will think about a third dose of vaccine. But till then, as on today, let us be little complacent that we have contained the COVID. And Tdap, now tetanus we were giving during pregnancy to protect the mother as well as neonatal tetanus. But now they also advocate diphtheria and pertussis vaccine between 27 and 36 weeks of pregnancy. And why so? Because the antibodies which are produced in the mother, these antibodies will protect the newborn in the first 3 months of life. The newborn's immune system becomes mature by 3 months, and then we start our immunization program. But during the first 3 months, the child will be protected by the mother's antibodies, and therefore mother should be vaccinated tetanus, diphtheria, and pertussis in the 27 to 36 weeks of pregnancy. Vaccines not to be given during pregnancy are MMR, varicella, yellow fever, and also BCG. What are the adverse reactions? There may be local pain and redness, systemic, mild fever, little aches and pains, because most of these viral vaccines which will cause flu-like syndrome. So little, malaise, and there is that psychological impact that I have taken this vaccine. So little malaise, little aches and pains and mild fever may be there, but that you can treat with simple paracetamol. As I said, 1 in million serious antibody reaction is anaphylaxis. And very, very, very rare, but I should make you aware about it, post-vaccinal demyelination causing Guillain-Barré syndrome. But that can be managed. So as doctors, we should advocate this adult immunization. But when we are advocating, this is a new concept, at least in our country. And therefore, there is a lot of vaccine hesitancy. We all have read and we have all seen the people around us. They were so hesitant to take coronavirus vaccine, COVID vaccine. Those who have taken first dose, they did not go for the second dose. That means you are putting the whole community to the risk. But they did not take the second dose. What is their argument? I am an adult. I have never heard of this adult immunization. The vaccination is given to the children. So I am an adult. I have never heard about it. No, I am scared about the injection needle. No injection, please. There is no epidemic, so why are you vaccinating me? Is there any alternative? What will be the side effects of the vaccines? What is the cost? Because they are all used to get everything free from the government. Free vaccination, free hospitalization, free this, free that. And now lot of programs are coming which are extending the healthcare to the people free of cost. So that when you are giving vaccines in the practice, they will ask you what will be the cost and whether it will cause a disease. This is a great myth that our community has, that by taking vaccine, that vaccine may cause a disease. Okay, and therefore what they need is education, advocacy, and counseling. And therefore you can train one of your assistants paramedical workers, that while the patients are waiting in your waiting area, your receptionist or other helpers, they can talk to these people. And those who are above the 50 at least should be educated, advocated, and counseled for taking this adult immunization. That is the way we will be able to help them. In addition, those who are diabetic, we have to give a particular attention to them, because diabetes in India is in epidemic proportion. As you know, every fourth or fifth person is diabetic. Naturally, there is immune compromise. He is so vulnerable to all the infections. And therefore, we have to talk to these diabetics. Then comes hypertensive, and protect them by giving these vaccines. Similarly, COPD and asthma. So we have to do our duty of protecting them by giving vaccines for at least these disorders. And please remember, vaccine against herpes zoster in aged people. Even if there are no comorbid conditions, we should give them. And diabetics, yes, particularly, all these vaccines have to be given. Then only the diabetics will be protected. Otherwise, there will be serious infections and serious adverse events. So that's all that I wanted to share with you. Thank you very much for your patient hearing. Okay, Tashi?
Thank you, ma'am. Thank you very much. So the questions, I will send them to Alka ma'am, and the answers I will post it on the group.
Yes. You know, because there are different companies which have marketed the vaccines. I didn't mention the companies' names here because that is unethical. Okay.
Yes.
But if there are any other questions, I will send you the answers and you can circulate or share with these people.
Yes, ma'am.
Okay.
Thank you. Thank you very much. Thank you, everyone.
Thank
Bye.
you.